I wake up every morning with a mission. Thank the Lord for everything that I was given. Only give energy to positive things. Focus on the joy the day will bring. Now I'm looking better. Right now, I'm feeling better. Right now, I'm living better. Right now, so turn it up if you feel me right now. Right now, I'm looking better. Right now, I'm feeling better. Right now, I'm living better. Right now, so turn it up if you feel me right now. Right now.
Welcome to the Jazmyne Show.
Good evening and welcome to another episode of the Jazmyne Show. I am your host, Jazmyne Simmons, and I am so excited that you have joined us this evening. We have a very interesting yet concerning topic this week. As we know, October 1st has kicked off Breast Cancer Awareness Month, so we will be discussing breast cancer and its impact specifically on the African American community. We know that this can be a heavy topic, but here on the Jazmyne Show, we speak from a perspective of hope. So we look forward to encouraging our community and sharing some vital information regarding breast cancer. Without further ado, we have three guests joining us. We will have Ms. Jacoria Borders, the Surgeon General at Florida A&M University for SGA. We will also have a long-term volunteer, Mrs. Harriet Hudson with Relay for Life. And we will also have community activist and public health activist, Mrs. Maisha Mitchell. So before we get into our topic, let's talk health and news and health in Hollywood. Recently, there has been an outbreak regarding a new respiratory illness. Some confirmed cases in Michigan as well as Kansas and Kentucky have found that the virus is considered to be the enterovirus EVD68. As of now, there is no treatment. Doctors recommend plenty of rest, fluids, and taking proper precautions. Some of those precautions include, of course, washing hands, staying away from members who you think may be sick, avoiding kissing or drinking after anyone who may be sick, and again, taking in plenty of fluids. In other news, there was some recent research regarding disabilities in children. In a study conducted from 2001 until 2011, researchers found an increase of about 16% over a 10-year period regarding disabilities being diagnosed in children. They noted that physical disabilities has been on the decline. However, neurodevelopmental disabilities have been on the incline, specifically mental illnesses. They are referring to this as a trend of research that they will be continuing to study. In other news with health and Hollywood, unfortunately, Hollywood lost another star in recent weeks, Joan Rivers, and recent notices have stated that the doctor who performed her endoscopy was actually stepping down. He was requested by the board to step down, and he took the advice and did so. Lastly, in health and news and health in Hollywood, former Olympian Mr. Pistorius was found guilty on homicide as well as possession of certain weapons. He is still awaiting his sentencing. Up next, when we come from the break, we will be diving into our topic of the evening, breast cancer. So stick around.
Now I'm looking better. Right now, I'm feeling better. Right now, I'm living better. Right now.
Welcome back. We are glad you joined us again. I am your host, Jazmyne Simmons, and we are talking about breast cancer awareness. We have three great guests lined up for you all this evening, so we're going to go ahead and get started. Ms. Jacoria Borders is the Surgeon General for SGA at Florida A&M University, and she's been working on some really amazing health initiatives and overall health campaign as well, entitled Get Fit FAMU. So she'll be shedding some light on what those activities include, what the campaign is all about, and what particularly they'll be doing to bring awareness to breast cancer. So hi, and thank you for joining us.
Thank you for having me.
We're so happy to have you here, especially to share what's been going on campus and all the new initiatives. So as a Surgeon General, what is your role on campus?
Well, it's simple. It mirrors the exact image of what the Surgeon General of the United States of America does. I'm almost like FAMU's doctor in a sense. Basically, I oversee any health-related issues that we have on campus. I work with all the clubs and organizations that are health-related. I have the esteemed privilege to work with Ms. Tanya Tatum, who's our Director of Student Health Services. We work hand in hand in everything that we're going through on campus as far as health relation goes. I work with just about anything health related, you name it, I do it.
So you're the go-to for anything health.
Anything health
Okay,
related.
awesome. So I've heard about Get Fit FAMU. How was that created?
I accepted this position back in late April, early May. And I was just thinking, what do we have going on campus that extremely just focuses on just health, but it's campus-wide? We have so many different clubs and organizations on campus, so many different colleges and schools that do different things and work in silos. But what can we do to bridge the gap and have everybody work together? So that's when Get Fit FAMU was born. And ever since then, it's been taking FAMU by storm. And I'm really extremely excited about it. And I can't wait to see it take off on September the 19th.
And that's awesome because, as we know, FAMU does have plenty of programs related to science and research, so it's really awesome to bring them all together. What are some of your goals for Get Fit FAMU?
The goals for Get Fit FAMU are simple. We want to promote campus unity on the highest of 7 hills while also touching the lives of students through health relation. You know, it's not just, we're looking at the holistic, healthier Rattler. So that means we're not just focusing on you exercising and getting fit. We want to take your mental health serious. Physical and mental health are very important, intricate roles in any type of holistic Rattler experience. We also want to make sure you have healthy eating habits. That's why we're partnering with Met's Culinary. We want to make sure that you're getting all the services that you have available to you, that you're utilizing them. So it promotes campus unity. And that's the goal number 1. And it spreads awareness. That's goal number 2. And it changes lives. That's goal number 3.
That's amazing. And speaking of bringing awareness, you have a huge week coming up next week. You have Go Pink Week, right?
Yes.
Okay, so tell us a little bit about that.
FAMU Pink Week is the first time that we've actually done this on behalf of Student Government Association, so I'm extremely excited about that. But we wanted to spread awareness about breast cancer because it definitely is an issue that affects our community very much. So the first day, this is the day and age of social media.
Right.
So
Okay.
of course with Instagram, we're having an Instagram challenge. It's FAMU, the hashtag is FAMU Pink Week. And so students will post pictures with that hashtag of how they go pink. We're bringing it back to high school where you had crazy sock and hair day. So whatever you want to do, if you want to wear a pink sock on your head, that's what you do because you're doing it in support of breast cancer awareness. So whatever you want to do, you do it and you hashtag it. The student with the most likes of their picture will win free tickets to the pink tie ball. So I'm excited about that. And then on Tuesday, we're doing Organizational Banner Day, where we're going to have banners taking it back to kindergarten all over campus, decorated. Well, clubs, organizations will decorate banners in honor of breast cancer awareness. Wednesday, of course, it's Fried Chicken Wednesday. You can't shake that from FAMU. But we're going to have Dying Pink in the calf. So the calf will be decorated fully of just pink, even down to the desserts.
Wow.
Then Thursday is our big event. It's Tallahassee's largest Zumba class, where we're asking all local high schools, middle schools, clubs or organizations, the School of Allied Health Sciences, and everybody to come out and really celebrate our Zumba class at the FAMU Village. We're going to have all kind of activities set up because it also serves as our Relay for Life kickoff. We're going to have face painting, bounce houses, all sorts of things for the community, and free food. So
can't go wrong with that, right?
Our students love free food. So I'm excited to see that everything that comes into play, and we're working on that very heavily now. And then we have our big event on Friday. Friday actually starts the Pink Set Friday. Well, the Campus Activities Board will be doing multiple activities on the set, and everything will be dedicated to Pink Friday. But the big event is at 7 o'clock p.m. and tickets are on sale now in the Lawson Gymnasium for the Pink Tie Ball. This is a humongous event sponsored by Student Government Association and none other than Student Health Services. And I am very excited about that because we actually get to the time to sit down and honor those who have lost their lives to breast cancer and those who are still battling it today. Okay. So that will be the main event. And we can't forget about the Saturday, October the 4th, which is our Pink game with Rattler Athletics.
All right, so you have an eventful week scheduled, and I'm sure everyone is excited. What kind of services will be provided? Screenings, will any of those things be taking place at the events that'll occur this next week?
Well, for Pink Week, the only thing that we're really going to be providing as services goes, of course, in conjunction with Get Fit FAMU, our glucose checks, cholesterol checks, bone density examination, HIV testing. I believe I already said blood pressure, didn't I?
I don't think so. Blood pressure, okay.
Blood pressure checks. And of course, we're going to teach students, faculty, and staff how to do actual breast examinations on themselves when they get out of the shower. Okay. But that's in conjunction with Get Fit FAMU.
Okay, awesome. So we are excited, and we are definitely looking forward to next week. The Jazmyne Show, we will all be there in support. So we want to thank you so much for joining us and sharing your information on Get Fit FAMU, and we look forward to it.
So do we.
So stay around. Be sure to follow Get Fit FAMU on Instagram. There will be so many things that you can partake in. This is not just a university-wide initiative. As she mentioned, she wants to impact the community through this effort. So be sure to follow Get Fit FAMU and stick around, because coming up from the break, we will be speaking with Mrs. Hudson, a longtime volunteer for Relay for Life.
Now I'm looking better right now. I'm feeling better right now. I'm living better.
Welcome back. As mentioned, we are we are mentioning and discussing breast cancer. Joining us today, we have Mrs. Harriet Hudson, a longtime volunteer with Relay for Life. So thank you so much for joining us.
You're most welcome.
So what is the history of Relay for Life?
Relay for Life, believe it or not, was started by one individual who decided that he wanted to make a difference. Dr. Gordy Clack was an oncologist, and in support of his patients and their struggle, he wanted to walk and see if he could raise some funds. So he invited his friends, his coworkers to come out, and he walked in Tacoma, Washington on a university campus track, very much like FAM. And he got a lot of support. Even some of his patients came out to watch him. And during his 24-hour one-man walk, he raised $27,000. Wow. So out of that event came the birth of Relay for Life. He decided, how can I get more people involved? What if I had more friends? And a committee was formed, and Relay was formed. And now it's global. It is all over the world and raises nearly $5 billion for cancer.
Wow, that is beautiful to see something so small grow into something so great that we now do every year. So how did you become involved with Relay for Life?
I'm a volunteer on the local Leon board of the American Cancer Society, and when I heard that Tallahassee was going to have a Relay for Life, I was excited. And so somebody said, will you be involved in the planning and will you help us? And of course I said yes.
And it just took off from there.
This will be our 21st year, and I've been doing it for the whole 21 years.
I know previously in conversation you mentioned you spearheaded some of the Relay for Life events in the past. What was that like, having to coordinate such a huge event?
Exciting, frightening, a lot of anxiety, but a lot of fun. It really was a lot of fun. It's a great community-wide event that brings together the young and the old. It's just people of like-mindedness who want to see this thing called cancer wiped off the face of the earth.
And I can totally agree with that. So with this being October, have the dates been set for the kickoff for Relay for Life?
Well, you've got to remember that there's several relays within the greater Leon community. There are 5 that are actually here. And I'm a part of the Leon Havana relay, which is going to be held in May. We have not established our kickoff date yet. We're still looking out to the broader community. We're looking for a site to host the kickoff. Okay. So if anyone within the community is willing to provide a site, we're looking for a place.
Okay, awesome. So how can people get involved with Relay for Life? I know it's often discussed, but what are some tips on getting involved in the community?
There are so many avenues for people to get involved. They can join a team. Don't know of a team? Start a team. They can become part of the planning process. We're in the initial stages of planning the upcoming event for May. And so there are many positions and a ton of volunteers that are needed to help organize our survivors, recruit survivors, to help with logistics, to help with entertainment. Perhaps we have some performers out there that would like to get involved. Singing, choirs, dance groups, comedians, whatever is your talent, we'd love to have you participate. We need volunteers on the day of the event. Volunteers are needed. Volunteers to help people get to the event. There are so many roles people can play. We just need people who are willing to give of their time, their energy, and their expertise.
Awesome. So are you involved in any other promotions as far as health promotion? Are you involved in any other events or things like that in the community?
I am captain of my relay team, and our team is called Sisters Alive. Okay. And Sisters Alive is an organization that deals with health issues, especially cancer-related health issues. And we are made of both lay and professionals who come together to address all types of cancer. Breast cancer was our initial focus, breast cancer in African American women specifically, and our focus has broadened to dealing with all types of cancers, cervical cancers, lung cancers, any of the cancers. We have some survivors that are a part of our group, and we talk about issues that are key to them, issues that are important to them. We talk about new therapies that are out there that are coming up, that are beneficial to people with certain kinds of cancers, and offer some support to the broader community. So Sisters Alive is, we deal with nutrition, we deal with physical activity, all the things that also impact your state of health. We deal with stress and stress levels that cancer patients often go through, and their families, because when someone's diagnosed with cancer, it impacts the broader family group. It really does. So that's what we do. We talk about all kinds of health issues relating to cancer.
And how can other people in the community become involved with Sisters Alive? Is there a way for others to be a part?
There's a way for others to be. We're always looking for people who are like-minded, who would like to focus on health issues. They can simply call the American Cancer Society office and tell them of their interest in participating in Relay, their interest in participating with Sisters Alive or learning more about the organization. And I can give you the number if you'd like.
Yes, go ahead, and we'll also list it at the bottom of the screen.
Great. It's 850-297-0588. And they just simply need to call the cancer office and say, I'd like to be involved. And I'm sure the American Cancer Society will find a place.
Awesome. Well, we are so grateful that you've shared that information with us. Everyone, please be sure to visit those websites that we will have listed so that you can see how you can get involved and raise awareness for breast cancer. Coming up, we will have our last guest for the evening, Ms. Maisha Mitchell, a community and physical and public health activist. Stay tuned. Thank you so much.
Now I'm looking better right now. I'm feeling better right now. I'm living better.
Good evening and welcome back. Thank you again for joining us. We have our last guest for the evening, Ms. Maisha Mitchell, with us, and she is very well known in the community as well as abroad for her efforts in equality and fighting health injustices. So thank you so much for joining us.
For inviting me here. I'm very excited.
We are happy to have you. So give us a little bit about how you became involved in community health.
Well, when I first started to work early on in my life, I wanted to be a social worker. And I realized that it wasn't broad enough. You know, I wanted to be big and broad, so I thought maybe I can reach more people by going into the health field. You know, I want to be a healthcare provider, I want to be an administrator. Did that for a while, realized that I really belong in community because I felt that people still weren't getting the services they needed, even though there were funding available, there were opportunities of accessing for services and available options for them, but they were not getting it. So I thought maybe we need to organize and get people action-oriented in their thinking. And that's how I got started. early on.
Early on. So to what extent have you been involved in raising awareness for breast cancer and breast cancer research as it relates to the community?
Well, I worked with the Office of Minority Health many years ago in the early 90s. And when I came back to Tallahassee, I was very excited about continuing my work here with the Commission on Minority Health. I started work with the American Cancer Society with Mrs. Hudson as part of the African American Advisory Board there. And Ms. Hudson really got us busy and working, very actively. And as a result of that, I got really engaged with the work with the American Cancer Society and started to teach people what they call the triple touch method, how to examine your breast, so breast self-examination, how to make sure people got annual mammograms, and then how to do clinical. Make sure you got your clinicals and ask the questions that you need to ask when you go to the doctor. That was one of the things we found that people were not doing, asking the questions.
Asking the questions. So would you say that's one of the key differences within community is asking questions? Especially, I know there's been research regarding African American and the impact of breast cancer and why is it so different. So would you say that's one of the
I would say that is certainly one of the barriers why people don't get the help earlier enough. One of the key things we found, though, is that oftentimes African American women are very silent about their condition and won't speak to it. And the family members don't even know. Sisters who know they've had cancer for many years don't even tell the other sister that they have it, or their mother. And so oftentimes what happens then is that it goes on into the community, that this person has passed away, and then finally somebody talks and says, oh yeah, that person had cancer, and the person in the home didn't know. And so silence is one of the key areas we find. The other thing is that we don't do early detection. We will note that something is going on in our bodies, but guess what? We won't tell anybody. And so then we deny that it's happening, and as a result, we don't get a chance to have people diagnose us early enough. So we have the issues in mortality rate, which is higher, than we would normally have in a community. So African American women are really in areas of need in making changes in attitudes and behaviors around breast cancer awareness.
And would you also, what are your thoughts regarding trust? When you are diagnosed with such a serious chronic illness, trust level with healthcare providers, especially within the African American community, to what extent is trust a barrier?
Tremendous. One of the areas that we talk about a lot with African American women in breast cancer is how do you get to break the silence? And many times the silence is not broken because people have fear of what they may find out. And a lot of that fear is associated with trusting and telling people their big secret, because somebody else will tell their story. And so we find women do not do that. And so our history has told us that once we tell stories, find out that we have illnesses in our families, we're not treated properly. It's not just system here in terms of health care. And folks won't go to the doctor, and they won't share, those stories. So trust has a major impact and a big barrier in terms of care in our community.
What would be some of your advice regarding early detection, getting checked, communicating with your physician? What would be some of your advice regarding those things?
Well, what we're finding out a lot with the research that we've been doing here at Florida A&M University around breast cancer and screening is that there is a need for more clinical trials. African American women do not typically enroll in clinical trials because of the trust,
right.
Because they say, well, it must be Tuskegee all over again.
Right.
And so they won't do it. And the other aspect of it is if they don't do it, then guess what happens? We don't get the medications that's available. So then often we're not given the time, we're not given the type of medicine, we're not given the advice that we need based on the fact that we don't have that available to us. The researchers don't have it because they can't get it if you're not participating in a trial. Right. So medications are developed for other people, but we can't use those medicines. They're not as effective with us as they are with others. And that's a big problem.
So that would be one of your main take-homes is getting involved, learning about clinical trials, being open with early detection and communicating with physician as well as family.
And asking the questions.
Asking the questions.
And then sharing the information that is going on. and finding somebody you can trust, to talk about it, because often we have problems with depression that is really not talked about a lot. Why people won't go to the doctor, mental health thing that you mentioned earlier, all those things are impacting our families because of the shame that's associated with it. And when you have shame, it's very hard to talk about something. But I would encourage us to start thinking about how we change that whole mentality in our community. What can we do? And here at Florida A&M University, in the Center for Health Disparities, the center that we're working with now in terms of the Center of Excellence in Cancer Research, Training, and Community Service, we're talking to people about how to make sure that the researchers and the people in the community have good relationships with each other. Because once we develop those relationships, I think people would have trust, and then the docs, are able to get the information they need from the researchers because they've gotten the right medications and all the things that are blending together now and making it happen. So we all play a very vital part in making this happen in our communities. And the persons who has had the experience with cancer, our families, really are the key people that are missing from the table. And we call that community-based participatory research. How important is that? We have to have more people willing to take the risk, to be involved, to be engaged, to talk, to become educated, because we don't all have information. And when we don't have information, we won't ask the question. And if we don't ask the question, we won't get an answer. If we don't get an answer, we won't get the treatment. So it's a big cycle, one thing after the other.
Right.
Yeah.
Lastly, just want to know, what events will you be partaking in this month?
Oh gosh.
There's a bunch, right?
It's a month.
There's a lot.
Listen, in October, we get hundreds of calls to the American Cancer Society. And we typically have anywhere from 10 to 15 different events that I have to speak. Okay. And people in the Sisters Alive group. So I'm very active in that. We also have the Cancer Network that we send people to if they need help with services, so we try to get people involved. And then we tell people oftentimes to call the American Cancer Society and find out what's going on, because something is always going on, not even in October just. October has a lot of events, but throughout the year, they have all kinds of great things. And so the American Cancer at 800 ACS 2345 is the national number, but if you call that number, they will hook you up with your local ACS group. Awesome. So October is going to be busy, so you're hearing from us. We'll be calling you, Jazz. Things are going on here. Come out and join us. But we know one thing for sure is that the more education we can get to our people, I think the better it would be, and we'll see our numbers going down. One thing for sure I want to say is that our numbers are greater in terms of deaths, but our numbers are not as great in terms of the people who've been diagnosed. So that's a major difference with Black people and people of different races.
Well, thank you so much for sharing your community expertise, especially as it relates to breast cancer. We really do appreciate you joining us this evening. So everyone, we are hoping that with all the information relayed, that you can find a way to get involved, that you can find a way to encourage, and that hopefully you have been encouraged through this episode. For more information, be sure to follow the links and to contact the numbers that are going to be given throughout the episode and at the end. We appreciate you for joining us this evening, and we look forward to seeing you at some of these events. So until next week, I am your host, Jazmyne Simmons.
I wake up every morning with a mission. Thank the Lord for everything that I was given. Only giving